subscribe, press the bell button so you can be notified every time I create a new video. Today I'm creating a video for you interpreters in any languages. As you know, I work for the emergency line, and this is 25 screening questions that the nurses and the doctors are going to ask to the patient. So you gotta know those questions, you gotta have them ready, and you have to be ready to interpret them in any language. Okay, before you start, please comment, like, share, subscribe. You can ask a video, you can ask a content. I will be more than happy to create it for you. My video, it's based on a real-time interpreting for the emergency line, okay? So those are the questions that the doctors or the patients are going, doctors or the nurses are going to ask to the patients. Forgive me, I am getting distracted. I'm so sorry about that, guys. Okay, so number one, do you have any pain? 2. Have you traveled outside of the country in the last 14 days? Normally, this question they ask in the last 60 or 90 days. But now, because we are in very, very particular situation, dangerous situation, it's in the last 14 days. Do you work in a healthcare, or are you search responder? Do you have any food or medicine allergies? Do you have any health conditions? Do you take medicine on daily basis? Are you pregnant or breastfeeding? All these questions matter a lot to the patient, guys, or their condition, because their conditions can change the fact if they're sick or not. Have you had any recent surgery? When your chest pain started? So normally they have breathing difficulty or chest pain. This is the 2 reasons that they go to the doctor or call the emergency line, okay? It's okay, what is the pain? Where is the pain? The middle, on the left, on the right side? Some people have pain when they breathe, and they have, do you have any headache is another question. And exactly where is the pain? Do you have radiation of the pain, or do you have pain on the spine, neck, hands, feet, and so on? Pain somewhere else. Is it the pain constant or comes and goes? How long the pain lasts? On the scale from 1 to 10, what is the level of your pain if 0 is no pain and 10 is the major pain ever experienced, or the maximum pain? What kind of sensation? Is it a stabbing? Is it dull? Is it sharp? Is it a pressure that you feel? Do you have any history of heart-related problems? Do you smoke? Normally they ask sometimes, do you use any kind of legal drugs like marijuana and so on? In the states where this is legal, they eventually ask those questions. Do you, in your family, is there a history of heart-related disease? Do you have asthma, emphysema, or blood clots in the lungs? There can be other COPD or lung disease that they sometimes ask, but normally the first screening is only these 25 questions, right? Do you take hormones or birth control, or also this include any kind of steroid treatments? That's important for you to know. Is it difficult to breathe all the time or from time to time? If you walk, do you have shortness of breath? Have you experienced any heavy sweating? Do you have vomiting or nausea? Have you fainted or passed out or lose consciousness? And do you feel confused or disoriented? These normally are the most common questions that they ask in the emergency line. Thank you for being here. I hope those questions was useful for you. Please share, like, subscribe, comment, press the bell button, and write a comment. Stay safe, stay at home, enjoy this creative time on your own. Thank you for being here. I hope you have a wonderful day. Take care. Bye bye.